Australian leaders are holding an emergency meeting as new coronavirus cases emerge across the country. Several cities have imposed lockdowns and made mask wearing compulsory. Experts say the current outbreak is the most serious since the beginning of the pandemic.
Sydney's iconic opera house, shrouded in silence. Its bustling streets deserted. The city has responded to an outbreak of the highly contagious coronavirus Delta variant with the 2-week lockdown. Meanwhile, a lockdown in Darwin has been extended.
The reality is we are not out of the woods yet, not by a long way. The risk to the community has grown in the past 24 hours. We are now in an extremely critical period. We must stay locked down while we keep this virus trapped.
Other cities have made mask wearing compulsory and limited social gatherings. Australia has recorded relatively few cases, 30,000 since the pandemic began. But its success in keeping the virus at bay is being threatened by a stuttering vaccination campaign. Only around 5% of the population is fully vaccinated.
We really face the most serious crisis in the COVID pandemic since the early days in February, March last year. It's made the worse because this was a largely avoidable and foreseeable crisis, but thanks to the very poor procurement and rollout of the vaccines, we don't have that strength to respond to the situation that's emerging.
As the virus forces life to a standstill, Australians can only hope that the vaccination rollout picks up speed soon.
And for more on this, let's cross over to Catherine James, a journalist in Sydney. Catherine, in new clusters of cases across the country, what's behind that?
That's right. As you heard, the case numbers are relatively low. So we currently have 130 in Sydney. The reason for Australia's lockdown is caused by the Delta variant, and that's happened in the last 12 days. Australia's tolerance for any cases is basically zero. It's the same in the Northern Territory. That lockdown is 4 cases, but again, with a much lesser equipped health system, they have locked down immediately. They do not want any further transmissions within the community. And so we're seeing that zero tolerance for COVID bringing in these lockdowns, and mainly so the contact tracers have time to get across the rate of transmission.
So I understand only 5% of Australia's population has so far been fully vaccinated. That's definitely not much compared to other highly developed countries. Even Germany is much further ahead. Why is the figure so low?
Well, as you mentioned earlier, the rollout has been slow. The rate of vaccinations that are arriving in the country every day has been small. And when you think about the threat level in Australia was so low, so the urgency to go out and get vaccinated was definitely not there. This situation, of course, will change that. People really do not feel that they want to be back in lockdown. It feels like we're back at the start. So that's going to be ramped up. The government, as you mentioned, is having an emergency meeting on Monday. No doubt that will be on the table in a very serious way. The state governments are pretty furious about it. The federal government has been in charge of that. They banked more on the AstraZeneca vaccine, and then the medical advice around that changed. So they are trying to ramp up their purchase and shipment of the Pfizer vaccine. And a lot of people were waiting for that arrival of the Pfizer vaccine for the people who are age 60 and under.
Journalist Catherine James joining us from Sydney there. Thank you.
Thank you.